us your name.
I'm Nancy Shaw.
And you are a registered nurse?
Yes, since 1985.
What kind of a nurse were you?
Mainly labor and delivery, maternal child health, and I also did some outpatient surgery, and then the last position I had was as a psychiatric nurse.
Wow.
Yeah.
Now, did you ever yourself administer vaccinations?
Just a little bit, and just a few times. Usually the nursery nurses would do the vaccines on the babies, thank goodness. But I did do a few, and my last job, by the end of the time that I was there, I did not want to be giving any flu vaccines, so I would just write in the information, someone else would give it, another nurse.
So you didn't want to actually do it yourself?
No. But I had many flu vaccines. I've had lots of vaccines, and I was kind of pro-vaccine. I went along with it. My children had vaccines. My dog is actually a vaccine injury patient. He's a beautiful golden retriever. He was perfectly fine. And then when he was 3, almost 4, he had a rabies vaccine, and the next day or two he started having some strange behaviors, and then he started having seizures later after that. And I didn't put it all together at first, but I did later. So anyway, so he's also a victim, and it's not fun. He has very bad seizures. It's very upsetting.
When you were at nurse training medical school, where you go to train to be a nurse,
Yeah.
what did they teach you about vaccines there?
You know, it's amazing, but they didn't teach us very much. With most medications and different classes of medications, we had to make out these intricate medication cards, and we studied, many different types of antibiotics, heart medications, many different drugs. And with the vaccines, basically what they said is that someone could have anaphylactic shock, especially if they're allergic to eggs. They might get a sore spot, and that we had to write down the lot number for the vaccine on their chart, which you don't do that with most medications. And so we really didn't learn a lot, and I had no idea, and I really feel bad. If I had known when my girls were younger, if I had known what I know now, I never would have given them all those vaccines. And most medications are the main medication, and then it's in something pretty benign like normal saline or water, something that isn't harmful. And so when you're a nurse, you're really busy. You're running your tail off most of the time. And you'll look at basic things about the medication. The dose, the route, the percent of medication that's in there. And you assume, and I'm sure this is the same with the physicians, that they're assuming that it's in something benign. I had no idea that there was formaldehyde and mercury and polysorbate 80 and 20 and fetal cells and all sorts of other viruses that get in there that should not be in there. And just assume that it was in something like normal saline. And it wasn't until I had been a nurse for a long time, had many flu shots without problems that I knew of. And then one year, it was about 2008 or so, I got a flu shot, and then I got really sick, bad flu. Not immediately after the vaccine, but, it may have been a few weeks or a month or so. And then the next winter, I got sick again, the same thing. Got the flu shot, got a terrible flu. And it was so bad, I gave it to my youngest daughter. And
you gave what to your youngest daughter? The flu that you caught from the flu vaccine?
Yes. Well, or that I was my immune system was shot and it didn't work, it didn't prevent it. So, I don't know. I'm not going to say because we don't really know. But I gave that to her. She didn't give me the flu. I gave it to her. She went to the hospital, and got checked, and they said she had the H1N1. She had a fever over 105, which was not coming down. I gave her the ibuprofen, Tylenol, I hate to say it, not coming down, so I brought her in. But they tested, so I knew that's what I had too. And that was like the end and the beginning, because after that I thought, I am never getting a flu shot again. And so I started doing some research on it. And in fact, I wrote a letter to our public health nurse at the hospital that I was working at. They're such a big forensic hospital that they have their own little public health department. And I told her some of the problems. And I think at that time they had banned the vaccine from a certain part of Canada, which I can't find online anymore. I think they took that information out. But anyway, I had told her things that I had learned, that the efficacy is not that good and it can be harmful and blah blah blah, and never heard anything from her or anyone. Never got a reply. But I never got another flu shot. And then when I became active against the SB 277 bill in California, because not only as a mother and a human being, but as an RN, it goes against our ethics to medicate someone against their will. And with SB 277, that is what is being asked of the nurses and the physicians' offices, that they medicate people who really don't want this, or they get kicked out of school, public or private. So I became involved with that because I thought it was such a horrendous thing. And so then it wasn't until I was actually collecting signatures to get it on the ballot this year so people could vote and say no, they don't want this, that I had some flashbacks about my daughters, and I started realizing that I think both of my girls actually had some vaccine injuries. And actually, going back to me, after the 2 years of flus, I started getting sick a lot. And I normally was very healthy. And I started getting fever blisters a lot. And when I went vegetarian, for 7 years, I never got one. But all of a sudden, so my immune system tanked. And then I had read that there was a study that showed people like me who are nurses or who get a lot of flu shots become more susceptible to getting the pandemic, the really bad flus, which, the H1N1 flu is a very bad flu. And, but anyway, my daughters, it hit me that my oldest daughter, who is 20 now, she has tics. And all of a sudden, when she was 5, she's rolling her eyes back, and I thought she was having some kind of seizure. And I took her into a pediatric neurologist, and she said, "Oh, it's tics. She has tics." And she also had some skin condition she had a biopsy for, and I kind of wonder about that too, if it's autoimmune. And so then my other daughter, she's been diagnosed with combination type ADD. She has a learning disability. She has a diagnosed weak working memory. So all of this has affected her in school and her self-confidence. And, I had always blamed this on the fact that she was adopted and was in the orphanage too long. But afterwards, I found out more and more that there's a correlation between ADD, ADHD, and the vaccine. So I believe with her it's probably a combination. And she also has eczema, which is related. So I don't want my girls to get vaccines anymore. And when they got into middle school, I would not allow them to get any vaccines. So they have had the waivers, so they would not.
All right, so what would your advice be? I mean, you're a registered nurse, your mother, you've been through it yourself and your children. What is your truthful advice to the people of America, the people who do not know what to do?
Well, I'll say non-nursing advice. I mean, I don't think it's worth taking a risk. I mean, something else I didn't mention is we actually had 4 vaccine failures in my family because I had the hepatitis B series because being a labor and delivery nurse. I've had them twice, and then there was a dirty needle stick, and they checked me, and guess what? I didn't have any antibodies to the hepatitis B vaccine, or to hepatitis B. And then my oldest had the chickenpox vaccine a couple years later. She gets chickenpox. And then I had the 2 flu shots, which did not work at all. So they are not working well. There's a lot of documentation on that. I wouldn't do it. If I were younger and having children, I would not vaccinate my children. But I say to people, you need to research it, but don't just go by, what's put out there by the CDC or, unfortunately what your doctor is saying. I feel like we've been lied to. Not only the parents, but the medical community, nurses and physicians have been lied to by the CDC. And we know there are many scientists now. There's 12, I believe, in that spider group who have come out that they were pressured, and their studies are not quite what's being reported. And then there's Dr. William Thompson. So I would look at other information. I would go deeper, because the problem with a lot of nurses and physicians is that they are really not looking deeply enough. And I have family members that will not look into it. Some in the medical world.
Well, so unfortunately, it's taking all of us to go to live through it.
Right, right.
To get it, because we were
right.
all pro-vaccine, as in we all
We
vaccinated
were.
ourselves and our children. So
You're right.
it's time for us to tell the truth. It's
Right.
time for us to stand up and
Yes.
say enough damage.
I feel like I want to serve physicians with a notice, with a registered certified letter that, here's this warning. Here's the facts that you're giving these vaccines that they are going to harm a certain percentage of your patients. And is that okay with you? Because unfortunately, some people are very stubborn, and they're not looking at all the facts. They just go by, smallpox and polio, which that's another very involved story, which we were not told all the truth about that. And in fact, my brother had polio, my oldest brother, and he's fine. And most people don't know that the majority of people are fine with polio, that it's kind of like a cold. They may not even know they get it. And of course, there are some people who were harmed. And, this also, the potential link of DDT, which my brother was exposed to in our home. My father told me recently. And another vaccine injury, my father, who's 94 years old, he's been getting the flu shots. He doesn't realize this or believe it, but there are studies on PubMed linking polymyalgia rheumatica with the flu vaccine, and my father has that, and he's been stuck on prednisone for years now because he had so much pain he couldn't even get up, could not walk. And of course, prednisone will take a toll on your body. And then my niece, my beautiful niece, was 5 when she was diagnosed with leukemia, and she's an identical twin, and this is how I ended up moving to California to help out. And she died when she was 9, and now I'm seeing some links with the vaccines to leukemia. And we knew another boy when he was about 5. He got leukemia. He's fortunately lived. But so it's just, I would tell people, look into it deeply. Don't just go by what your doctor says. Look into it and weigh the risk. I had measles as a child. I had whooping cough. I had German measles, and I had, I'm missing one. Measles, German measles, pertussis. I don't think I had mumps. Chicken pox. I had all of that. We all were getting this. All the neighbors. I lived in a busy area on Long Island, and And my father too lived in a part near New York City. He doesn't know anyone who died or had terrible ramifications, complications from these diseases. I mean, it is possible, it can happen, but in the United States with, you know, our good quality medical care and nutrition and sanitation and help, you know, better water, you know, measles was not a big deal at all. It was nothing. I was watching TV with my brother. We had it the same time. That's my memory, is sitting there watching TV with my brother. And people are so afraid now because of the media. Right, the
exactly.
media.
Well, we're really, really grateful to you.
Oh, thank you.
Thank you so much for telling the story. We've got a lot of stories.
Thank you.
So we better go on with the
Thank
Thank
you.
you. You're amazing.
Thank you. You're amazing, and you too, Anu. I appreciate what you do.
Anu is amazing. He's doing about 5 jobs. He's a driver, editor,
He's
cameraman,
Jack of all trades.
everybody at the moment. Well, everyone's away. All right.